thank you very much. It's a pleasure to show you something about our project. It's about strategies for addiction treatment and new psychoactive substances in Europe. I'll tell you something about my organization, my non-profit organization first. Maybe as an introduction for you all, because I haven't the possibility to show us our organization, the Pedagogical Ludwigsmühle. So I start and take you with me to the southwest of Germany. So our non-profit organization, it's a addiction help organization, Therapieverbund Ludwigsmühle. It's hard to spell for the most of the people. I'm the CEO of this non-profit organization, and here you see the southwest of Germany. You see Luxembourg, Belgium, France, and we have inpatient centers. The first inpatient center is called the Ludwigsmühle, so it's the name of our first facility, our first special clinic. I will show you some pictures of that, and it's down there in the southwest, and then two facilities, inpatient centers in the north of Rhineland-Palatinate. That's the federal state where our facilities are. And then we have outpatient centers, the green one, also in the south of Rhineland-Palatinate. So, and if you say it in English, it's the Therapy Association Ludwigsmühle. So, on our first facility was founded 40 years ago in 1981. It's called the Ludwigsmühle. It's in the southwest. It was one of the first special hospitals for drug-addicted people in Rhineland-Palatinate. So it was not really common to treat drug-addicted people in Germany, or maybe in the whole world. So there was the movement of the therapeutic communities, and this was one of the first special hospitals for that. Then after that, in the 90s, we founded the Villa Maria as a special hospital for drug-addicted parents who want to have treatment with their with their children. So they come together there with their children and have the rehabilitation there. So, and there's a special care center also for the children. It's called Kinderhaus, also children's house. So. Then we have a socio-therapeutic center for transition and transfer. It's a kind of social therapeutic transfer from the anti-toxic, was heißt Entgiftung? Detoxication, between detoxification treatment and rehabilitation, and in between we have this socio-therapeutic center in the north of Germany. Lisa is the leader of this center. And then an adoption center, Quellenhof. It's the last. It's the last sequence of the rehabilitation, so it's called adoption in Germany. And then we have socio-therapeutic assisted living and housing in Germersheim. It's also in the southwest. So these are our 5 inpatient centers. And our outpatient centers, the first is our counseling and treatment network, NITRO, founded in the 90s. There are 3 counseling centers, addiction. We do the addiction counseling and prevention. Martin and Anke, they are the leaders of this treatment centers, this network. And there is also outpatient therapy and rehabilitation, and we have self-help groups in several self-help groups, also for parents with addicted children. So then we have a big center for career development, job development, special for people with addiction biography. So to get them back to job, so we have a big career center for that with many projects called like Jobcom, Ahoy, Crossroads. Ahoy, it's coaching and counseling program for long-term unemployed people, often with addiction problems. Marcus is working in Ahoy. Also Crossroads, the dare care support program for unemployed youth and young adults. Third step, ADH, it's a project carpentry, so we can work with our former addicted people in this carpentry to get back to job. So also we can they can work if they're in rehabilitation in Ludwigsmühle or Villa Maria, they can work in this carpentry. So for them, so just like ergotherapy, sports therapy and something, do that there. So we have a special work and integration part of that project for inpatient clients. So, and last but not least, so social pedagogical family assistance for addicted families. So, and we have we do something more in the digital way. We have a podcast, Freedom Without Pressure, is the international title. So it's called Freiheit ohne Druck. There's background information. You find it on Spotify, on Apple Podcasts, and somewhere else. It's in German language, so maybe it's interesting for the Austrian colleagues too. So there are live streams, online discussions, digital self-help groups or digital self-help and client reports from rehabilitation. That's really interesting. So we have some of our clients, they give the report of their rehabilitation, a short report in the end of the rehabilitation, give them the therapist, and the therapist is reading that in our podcast. So without any names, and it's anonymous, but it's really interesting for other clients. So, and you can find it on YouTube, Facebook, Instagram under that title, Freiheit ohne Druck. So now we come to our project, our international work. So that we have created with our partners about EuroTC. It's I came with the idea some years ago, 2018, I think it was, Thomas, on a conference in Toledo, and we talked about this topic of new psychoactive substances, that it's one of underestimated problems in Europe, and we have to do something, especially in the practical work, because we have no concepts for them. We have many problems with these clients who use these drugs. So we have a problem. First was the reactions in YouTube in Europe to NPS development largely consist of an adaptation of judicial prosecution, less than the adaptation of help and treatment concepts. So there's only concepts for the justice, but not for the treatment. And so that's one problem. And the second one is that tried and tested concepts, concepts who were working about 10 or 20 years, they reach their limits for various reasons, because of false proof or of abstinence. You can check them, you can make a drug test in our treatment centers, in the inpatient treatment centers. The professional came there to the team meetings and they say, client X, he is maybe intoxicated, but we really don't know, is that true or is that false? We make a drug test, and the drug test is it's not positive, it's negative, but everybody knows he or she is intoxicated, and what should we do in that case? So, and that's a big problem in many team meetings. So, and that and other problems we want to discuss in on our project. It's a strategic partnership. So it's a strategic partnership for practice exchange. So the first goal is to have a practice exchange around that problems, around new psychoactive substances, to talk to each other, to know, are there concepts for that? What concepts do you use? Can we adapt something? Can we give you something? So a classic practice exchange. So, and within that, we will have a training of experts and multipliers at the partner organizations within that framework in short-time activities. This is one short-time activities, maybe it's the last short-time activity we had planned for, from 3 to 5 days. So, and then in that we want to analyze and reflect our current practice, as well as communication and testing of new strategies for dealing with new psychoactive substances. And maybe we can make the first step to develop new concepts for that. Yeah, and then we will establish and operate an online platform. You find a channel on YouTube, handle it. We have it on Facebook. Maybe we make a little Instagram channel for that. We have a web page for that. I will show you that on the next sheets. So we have several partners for that, combined in the network of EuroTC. So there's us, the therapy from Ludwigsmühle, Eritrea from Portugal, Site Nietzsche Susret from Croatia, Therapie Salon Ball from Austria, Megalo from Hungary, BWLV from Germany too, and from Italy, the Comunità di Venezia. So, and the main part of the project is the good practice exchange, as I said. We have 7 teams from these organizations with 5 to 7 persons each, and then we have the learning, teaching, training activities like this one. We have practice exchange, and after that we go back to our facilities, to our treatment centers, reflect all the knowledge and in the practical world. And also we have thematical working groups. We work between these, we work online on a Microsoft Teams platform between our meetings here. So, and our learning, teaching, training activities, they are about 4 topics. The first was low threshold access. How can we reach the clients with new psychoactive substance abuse, with low threshold treatment or low threshold project. We had that in Hungary with Megalo. These LTTA, it was our first LTTA about that topic. Then we are here for the topic outpatient care and treatment and prevention. That's our main topic of this meeting here. So we had a meeting about inpatient care and treatment. We had that online, and the host was Croatia in January this year. And we had a nice LTTA in Austria about the topic of aftercare. How is the topic of new psychoactive substances connected to aftercare, and how can we be responsible for the clients who maybe are in danger for a relapse. So, and then we reflected in our thematic working groups. I will show you that on a later sheet. So then we had the COVID-19 situation that was a little bit difficult for us. So our cooperation was switched from a presence to an online meeting, but we have done it very good, I think. Yeah, we started from day one, but we had planned it from day one. We had an online platform, we could use it. In November 2019, we started with an online platform to work to each other on Microsoft Teams. And when COVID came, we had a platform with all our participants, and we could work on it. So it was, we had a good start for that. But it was hard not to get connected to each other and not to meet each other. So that was very hard for us. And but we founded some working groups with some topics. I will show that later. And we had then the third LTTA online on this platform on Microsoft Teams. Yeah, and meeting in person, we tried it. We made some tries for that and plans for that, and in the last minute we cancelled it again. So, and in this summer we made plans for 2 big meetings and made it in 1 to 5 minutes planned. So, and Fernando has planned this meeting in only a few weeks, only 2 to 3 weeks. Yeah, it was very hard to plan it, but we made it. Yeah, with very big work from our colleagues from Portugal. So that is possible to meet her and that number of colleagues here. It's very it's a pleasure to be here. And we could make these quick planned activities here. And then we have a project extension till March 2022, and then the project has to be finished, so with all results and something. So on our working groups, we're working in between. It's about, first it was experience in low threshold projects. We talked about that in our first meeting. How are their clients connected with these projects? Are their clients with an abuse of new psychoactive substances, or where are they? Then we had a working group about a client survey, so about new psychoactive substances consumers. So we want to know how is the consumption motivation for that, and maybe more. So, and we have done that. So we have the results, and we have done the analysis. Also, our partners from Freya have done the analysis, and now we are working about these results and to have a nice presentation for that. And then we are working on client case studies with biographical details. We want to show it on our webpage for that, and show how are the biographies of NPS consumers. Maybe there are similarities between these cases, and what's the thing. Yeah, and last but not least, we are working on a staff experience survey. It's our last survey, so we want to finish it and spread it in the winter and have some results in spring. So, and the online platform I talked about, we are on, we have a website, handle it info, Facebook, and also we are on YouTube. We want to do some, we make some mobile reporting work here. So we do it together. We cut some little videos about it, and we have a nice dissemination online. So that's handle it. Thank you very much, and look on the platforms.
Also have the problems with addiction and the new psychoactive substances in a strong way here, and that you are also doing work to find solutions also maybe for treatment. And what we do here in this project is that we have members from different European countries from a treatment network. This is called EuroTC, European Treatment Centers for Drug Addiction and Mental Health. And as we are here in beautiful Madeira and we enjoy your hospitality very much, we would be very happy for ongoing cooperation, maybe with the colleagues from here, which could be very fruitful. And I mean, just to say, because I'm part of this network for more than 30 years, and always when it comes to treatment of addiction, we have to state that we know how we treat addictions and we are very successful. We always have to say this because it always seems different, or there are different strategies, and we will also be very successful in treating these new persons who have problems with these new substances. So we will find the solution, and the solution is through the cooperation, and we are very happy that in this case we have this European network. So the background, EuroTC, European Treatment Centers for Drug Addiction and Mental Health, is a European network. The focus is on the exchange of experience and always aiming to raise the quality. So we are very keen to have a high quality, to have the best quality in our centers. It was established in '82. It's registered in Germany, and it started with members from Germany, Italy, Switzerland, and Spain. So you see that it was also culturally interested, the Germans together with the people from the south, and this was very fruitful. Recently we cover 12 European countries with 31 members, all very experienced. Here you see this coverage. It goes from Cyprus, Portugal, and Ukraine on the other side, and we hope to also go in this direction here and have Madeira maybe for the future as a part, you know, to also widen our local activities. So the network is governed by a board of directors, which is elected by General Assembly for 3 years. The secretariat is based in the moment in Vienna. It was before in Germany. It can move anywhere. And there's an annual work program adapted by the General Assembly, which we will carry out on Friday here in Madeira for this year. And we're very happy to have participants from here just to join us and to see what we are doing here, what work we are doing. Here you see the board. It is very chauvinistic, I have to state, you know. In fact, we have one female member. This is Bernardica Juretić from Croatia. She was the former Minister of Social Affairs and Health from Croatia even, so on a very high level for Croatia. There will be elections next year, and I hope that maybe from you, more women maybe will apply and join the elections. Otherwise we get bad reputation in this direction. This was in Madrid, the board meeting, organized by the Spanish colleagues who are very active. The constitution, the association is a European association, but open to cooperation outside. Internationally, we have strong cooperation with Mexico and with Iran, interestingly. The association's purpose is the promotion of measures to attain the goal of reducing the demand for drugs, which is very important because it's on lower importance in the moment in the European Union, and we want to strengthen this, and also to improve prevention and treatment services and the integration. So counseling, assistance for work carried out in outpatient, semi-residential and residential facilities. Thank you. All kind. Here you see again the Portuguese colleagues. This was in Coimbra, Portugal, very active. You know, you see Fernando here. It was a meeting around 6-7 years ago. Thank you.
No problem.
This is something else we did. This was the so-called Soccer Without Drugs Cup, which is carried out for many, many years. It's on hold also through the COVID. It was for clients, for patients who came together and had soccer competitions, which were very famous, I would say, you know, and was very good also to strengthen from the side of the, maybe you sit here, from the side of the clients. So the spectrum of activities, the spectrum of activities. Now we have more female presence here. Maybe she will apply for a board. The spectrum of activities is mainly to carry out international seminars and conferences, but also that what we do here, the participation in European but also international projects as a member or through different members, because mostly not EuroTC only, but some members of EuroTC make a project. Staff exchange, very important. So staff can go to another facility for a week or longer, to learn how the others work. Then we have representation in 2 counseling bodies for the European Commission. This is the Civil Society Forum on Drugs. And there are many political lobbying groups also for the drug problem. And we want the one to also feature the treatment and the prevention, so that's very important. And also at the UNODC in Vienna, in the Vienna NGO committee, where I used to be the president also for many years. So what's on hold and has to be vitalized, and it was also through the COVID, are the ongoing and permanent working group. We had one permanent working group for the treatment of mother and children, but also for gender issues and different other issues. So we want to reactivate also the International Soccer Without Drug Cup and Youth Forum for Patients, and then a yearly international theater therapy seminar. This was also client activity, and you remember, like one time in Padua, we had a big performance in the local theater, and this was very good also to show the public that we do important and good work, and it's very helpful for the clients for self-esteem and direction. Here again, the Soccer Cup, Berlin. So in which European project have we been? Some very important one was for many years the Democracy, Cities and Drugs. It helped to find local answers to the drug problem in cities, in big cities. We were together at this time with Stuttgart, with Berlin, with Lille, and with Antwerp in Belgium. Very interesting, all the mayors were involved, very good outcome of this project in practical way. Then we were involved in a peer drive clean, which aimed for young drivers who had many accidents to drive without the use of drugs and alcohol, how to do this. Other Erasmus projects were the MOMO, motivation about reintegration into the work field, about the motivation of older addicts in motivational process, another project. And now, in the moment, we are in a project of further enhancing the implementation of the quality standards in treatment in Europe, in strong cooperation with the EMCDDA in Lisbon. So we're very proud also about this project, and in cooperation with the Iran, about the strengthening the social support and the integration of homeless drug users in society. And we don't believe they have a huge drug problem. They try a lot to do. They try to bring in high quality therapy, and we are also happy to assist, and it's supported by the European Commission. And then we have another project, Interleaf, about women and drug-induced violence. And just to mention, for some period we had operational funds which helped us, Fernando knows, to carry out an ongoing program of staff exchange of helping the clients. As it is in the European Union, this suddenly stopped, and we were not financed anymore, not only we, but everyone in this who was financed. So this was a big problem for us for financing this, because funds get little. But we will handle it, not only the new psychoactive substances, but all problems. And I'm very happy, Dirk, that you found this very good title, Handle It, because that's our philosophy. We handle problems. Yes, here other picture from EuroTC against with Freya conference in Coimbra, peer training. So we did a lot also in training, in prevention, in treatment. And what is the relevance? We highlight the importance of demand reduction, which is in the importance going down Also, the drug issues go more in the European Commission to the health direction, Direction General Health, and there we have very little influence. We are not important. So this is important to raise awareness, pointing out the relevance of prevention treatment for the field, and also demonstrate the best practice and models through success through our expertise. And one part of the expertise is that we exchange and we tackle the new problem with the new psychoactive substances and quickly find an answer, not only controlling but treating. Yes, and here a picture you see, active from Austria, our last meeting. It's not the flower island Madeira, but it's also green, you know, and yes, thank you for listening, and I hope that we can really establish more cooperation with you. Again, thank you for your hospitality, and we are really impressed by you participating. Thank you.
So, thank you very much. Good afternoon, everyone. Special greetings to the President of Freia Portugal, Dr. Fernando Mendes, for the President of this project, handled it, Dr. Dirk Kratz, and for our keynote speaker invited, Professor Thomas Legl. This is very important for us, this meeting, about the new psychoactive substance in Madeira, because we have that problem. We have this problem right now here in Madeira. Our history with the new psychoactive drugs started in 2012. I was very much involved with the situation because at that time I was the emergency director of the emergency room in our hospital, main hospital. So all the patients with different behavior, unstable behavior, and behaviors that we don't understand, start to appear at that year, 2012. We created a new strategy in the emergency room through our Manchester triage with some diagnostic to identify better these young patients that are arriving during this 2012 in Madeira. We have more than 300 patients, and as an inpatient, most of them was conducted to the mental health institution from Madeira. And we have the cost about 80,000 euros with these 300 patients at that year. Some difficulties with our legislation. The first resolution of the government didn't pass in our Madeira Regional Assembly in July, and we was succeeded 4 months later. And the new resolution that permits to close all the smart shops in Madeira in 2012 goes in front, and it was approved. I want to congratulate our services that are related with this fight against the new psychoactive drugs. The psychiatrist service from the hospital, Professor Daniel Neto, is here with us. Nelson Carvalho, running the unity of comportments and toxicodependence here in Madeira, and the CDT, the Commission of Dissuasion and Toxicodependence here in Madeira too. My presence here is to give all the support from the government to these institutions to keep going with the fight against the new drugs. And I hope that this kind of meetings that we are having now here in Madeira could be a good opportunity to share all the new strategies, the new treatments that in other countries are already implemented. I want to say that the last study from the ECAT in Portugal, Madeira has a good position against the tobacco, alcohol, and other drugs, but related with the new psychotic drugs, we don't have a good position. So we need to struggle, continue to struggle against these new drugs that affected all the young people. And I hope this meeting could be an opportunity, as I said, to all of you, and for us from Madeira to share with you your experience on this field. Thank you very much, and I hope you enjoy your stay here. Our culture, our gastronomy, and our landscape, and our security, sanitary security that we have improved here in Madeira against the COVID-19. We were succeeded against COVID-19. I think we will be succeeded against the new psychoactive drugs. Thank you very much.